Hi everyone, I'm Melissa Cochran, Wellbeing Development Manager here at Pharmacist Support, and I'd like to welcome you to our latest Act Now Wellbeing panel chat that today will focus on workplace culture and the challenges facing pharmacy organizations and teams when it comes to mental health and well-being. Joining me today to share their experiences, views, and insights are Amandeep Doll, Head of Professional Belonging at the Royal Pharmaceutical Society, and Kim Ennis, General Manager at Teva UK. So welcome both. Now we know from the market research that we've been conducting over the past few years, including the Joint Workforce Wellbeing Survey with the RPS, that long working hours, a lack of cohesion across the pharmacy sector, poor mental health, a lack of colleague and senior support on the job are all some of the core issues facing the pharmacy profession today. Respondents to this research have also told us that they needed support managing stress at work, managing their work-life balance, and with sharing best practice. Nearly 9 in 10 respondents were at high risk of burnout, with many aware of the mental health and well-being support that's available, but with take-up of these services being generally pretty low. The barriers identified to accessing services included concerns about confidentiality and the impact on people's careers. So this obviously nods to cultural issues within the sector, a topic that we're keen to reflect on and discuss a little bit here today. So Aman, I'll come straight to you if I can for your thoughts on this. What do you see as the main challenges facing pharmacy organizations and teams today when it comes to mental health and well-being?
Thank you, Melissa, and thank you for having me on the panel today. And so I think from my experience and what I've seen working at the RPS and working alongside Heidi on the Workforce Wellbeing Project is there's a lack of psychological safety when it comes to the culture within organisations to be able to openly share if something's wrong or if you're experiencing poor mental health, particularly if it's work related, if it's to do with the workload or lack of support. And so there's not always, people don't feel safe to share it and they don't know who to turn to. So I know from my own personal experience of having burnout, you feel like you're already overwhelmed, and then having someone say take the time out to look after yourself or access services just seems like a big giant leap to do because you don't know where you're going to find the time. So I think there's something about having more support for individuals and just taking a step back, and that's why things like rest breaks and protected learning times are so important as strategies, because we need to support people in the workplace while they're working. The other thing might be that people don't know that they're have actually experiencing burnout. I know, again, from a very personal experience, it's only when I attended the RPS Workforce Wellbeing Action Group, listening to other people about their experience, that I started to recognise that actually I was experiencing symptoms of burnout myself. And then if you do accept that you've got burnout, it's actually being okay with that, because there's a prestinism. People feel like they have to present within pharmacy. You always have to be available, do the right thing, and you don't want to feel like you're going to be held back from career development opportunities because you're being perceived to not be able to cope. And so I suppose from a pharmacy organisation, what we could be doing is about the employers and organisations creating a culture where actually you're committing to being positive and having that safe space, but also making sure you're putting that into action, because it's all really well and good saying, we acknowledge people with poor mental health and we need more support. But if you're not then allowing that within the day, or the systems aren't there, then people might feel like it's a bit tokenistic.
Yeah, that makes perfect sense. And I also wonder if there's a lack of sharing that other people are going through it. So I think the truth is it's a much more pervasive problem than people probably realize. And it's not just an isolated incident here and there, but that possibly due to stigma or fear, there's just not the knowledge that it's as widespread as it is. So I just wonder if you have any suggestions or examples of what organizations are doing to overcome some of these challenges.
So from the RPS's perspective, we've got a campaign looking at workforce wellbeing, and for us, data is really important. So that's one thing we've said to organisations is about collecting your staff experience satisfaction data, so you can identify what the problem is. But one thing we have tried to do, because as a professional leadership body, we can encourage people, we've launched the RPS Inclusion and Wellbeing Pledge. So people can commit to doing the right thing. And as a leader perspective, you're setting out that commitment to your organisation. Other things that other organisations have come to us with are things like, it's called like an accessibility passport. So traditionally it's been used for people with a disability, but it can be adapted to have those structured one-to-one conversations with your line manager to say, actually, I'm struggling at this point, because isn't always necessarily work related, but at least then there's an opportunity to have that conversation, and then it's documented. And if you've got a line manager change or you need to go into a different environment, you can take that with you rather than having to repeat yourself again and again. So there's just a couple of things that people have suggested to us.
So Kim, I just wonder how that resonates with you. Would you agree with what Aman has said, and what your thoughts are on the issues raised so far?
Yeah, I would echo everything that Aman has said, and we've just been looking at accessibility passports, just in different ways in being able to communicate. Now, we're quite a big organisation, so in that way, we're relatively privileged that we have places to go. We have a very well structured sort of employee assistance programme. But I think one of the key takeaways for us is that whether you have all of the tools to be able to help employees, it's more about having an inclusive environment. It's more about actually being okay to talk to someone, to be able to remove the stigma of mental health, and actually generally just to be able to say it's okay to not be okay. So even with the infrastructure that Teva has and all the help that we have, we're still finding that we're having to embed that inclusive culture, that we have to check in different types of ways, be prepared to listen slightly to the responses. I think it's something like three out of 4 people, when you ask them if they're okay, they'll respond, I'm fine. Actually, next time someone responds to you and saying that, maybe just take a pause and ask them another question. Are you sure you're okay? Is there anything that we can help you with today? And we're finding tactics like that are helping people open up and come and talk freely. We're also celebrating well-being and mental health in a way that people do realise it doesn't hinder their career, it actually enhances their career. We encourage them, and I know it's different, we're a corporate organisation versus a busy pharmacy, but even having those 5-minute break, but going outside of the building, having that time collectively as a team, be it 15 minutes before the store opens or 15 minutes at the end of the day, just to reflect on what a good job you've done today, or actually how many patients have you helped, what have we done as a collective, also helps people feel their value and feel slightly more calmer. Now, to change culture, we definitely have gone from a peer-to-peer relationship. And I think, Aman just shared then that she's had her own situation. I do find that people telling their stories and their outcomes and how they have felt better, how their life has changed from it, is a good way to encourage others to speak up. Making sure that there's something simple where they know who they can talk to and how they can talk is really important. We have a lot of mental first aiders. Now, they're not there to give advice, they're purely to listen and then signpost them to the best places. So they're relatively quick things that any organisation could pick up. I think you do need an ambassador. I think you need someone in your organisation that wants to fly the flag, because it just makes people feel much more safer that generally it's okay not to be okay.
And you've given us a lot of examples already. I just wonder if you have any other examples that you'd like to share of things that organizations might be doing.
One of the examples we do have is that we've led probably similar to the RPS. It's an employee brand, so we have wellbeing champions, so that actually it's done at grassroots level, so that everybody is looking to understand what are the simple things that we can do to improve wellbeing. Podcasts, interesting conversations, people come in to help us with things are some of the tools, but generally also things like a sunflower competition, taking a picture of your favorite animal and how that makes you feel. So really simple community tactics also work, just to make people feel, just to feel better, make you laugh. You know, we try and make funny pictures, things that stimulate a bit of laughter. Laughter tends to alleviate stress and anxiety. You know, every morning I have to go out for a walk and listen to a funny podcast. Definitely a comedian, someone that just makes me laugh and get warmed up for the more serious side of my work life. And all of those you can do wherever, you know, wherever you're working, and actually doesn't take too much time to organise, but generally together that cohesiveness of a team.
Just to add, I suppose, on Kim's point about the being inclusive, and you know, it's also about accepting people and celebrating who they are. So we found that with doing like celebrating national events like Black History Month and, you know, International Women's Day and things like that, people feel seen, you know, and that also helps in being able to share with your colleagues and peers. So sometimes it is just thinking more broader than just mental health, you know, elements, and actually how can we celebrate the person as a whole, and then just think, because then that also helps us consider what they might be going through outside of the workplace and how that might impact on their responses or how much they can cope with.
Okay, well, that's all we have time for today, I'm afraid. Huge thanks to both of you, Aman and Kim, for your time. It's been a really fascinating conversation. I've loved hearing about all of the ideas that you have, lots of things that people can take away and try, and a lot of them are really small things that could be implemented quite easily and quickly, which is great. We realize that this is a big topic for such a short chat, but I hope this conversation has stimulated some thoughts and ideas, and that you'll continue this conversation with colleagues in your places of work and share any thoughts or suggestions you may have with us too. So thanks for tuning in and for making time for well-being.